welcome to Just Drinking Problems. Today, got Miss Anna back with us, and we're going to talk about government-run healthcare.
Yeah.
So, I already, just the title sounds awful. Great title for the video, but the idea of it, ugh.
Yeah.
I think, right off the bat, when I hear those words, I think going to the DMV to get help for my busted up knee. You know what I mean?
I mean, that's exactly what it's going to be, an assembly line.
That's a good way of putting it. So we do have a video, because a lot of people, when you talk about government provided or government run healthcare, basically means like free to me healthcare. I don't have private insurance. I don't have employer paid insurance or something like that. And literally my healthcare is provided and comes from and is funded by the government. Some shape, form of that.
Yeah, state and federal funding usually.
Yeah, but a lot of times when people talk about that in their pro-government healthcare, they talk about some of the European countries, practically all the European countries, but closer to home for us is Canada. And I mean, you always hear stories like, well, we could just do it like Canada because they're a Western country and, they're a little closer to home. And we can get into all the stories you hear about people that are citizens of Canada that come to America so they actually get quality health care.
Yep.
But we do have a video of this lady. I'll go ahead and bring it up. And she is actually, look at her cute little flag there. She's from Canada, and her little title here is a warning about government-run healthcare. So do you want to start off with her, or do you have anything
let's play the tape.
Okay. That's showing your age, tape. When's the last time you actually saw a tape? You know what I mean? Like a cassette or a VHS?
I mean, it was that or roll that beautiful bean footage.
Mm-hmm.
Again, showing my age.
Yeah, I guess 90 kids would get that.
This is a message to all Americans that think Canadian socialized universal healthcare is a solution to all your problems. Canadian here, and I'm going to let you in on my lived experience with the Canadian healthcare system. I'm going to preface this by saying that this isn't the experience of all Canadians, but unfortunately it is the experience of many. There seems to be a misconception that everything is free here. It isn't. Dental, vision, prescriptions, and all forms of therapy are all paid for out of pocket unless you have some form of health insurance. We also pay a crazy amount in taxes. Canada has a population of 38 million people, which is roughly the size of California, and 1 in 5 people don't have access to a family doctor, which is roughly 6 million people.
All right, I'm going to pause it right here just so we can see. She put up a screenshot of article. It says 6 million Canadians don't have a family doctor. A third of them have been looking for over a year. So, actually, I could Google this and find out what it's about, but I'm not about to waste everyone's time reading that. I'm just going to go ahead and take her word that she actually does live in Canada and she actually does have an idea what she's talking about, because I don't live in Canada and I don't have an idea about the Canadian healthcare system other than just things I hear, like her video. But she said a couple of things there. One, it's not completely free. So if you need something outside of your general idea of health care, as in like I go to the hospital for something. So if you need an optometrist or you need some kind of dental work or you need a therapist or something like that, you're coming out of pocket, or you have insurance of some sort to cover that. So we do too, right? So we have healthcare in America. So if I need to go get my broken arm fixed, or I need a root canal, or I need glasses, or I need to lay on a couch and tell this stranger about my messed up thoughts, like, we have insurances for that. So it looks like just the kind of help you would get or the care you would get at a hospital is what their socialized system funds. And bringing up that Canada, population-wise is like California. That's really fucking small compared to, like, I think she said 38 million people.
We have, 300 million people in the United States?
330 million American citizens.
Yeah. It's an astronomical difference.
Yeah, huge. And everyone uses the healthcare system at some point in some way. Like, it don't matter your age, right? Like, maybe like babies and elderly people use it a lot more than people in the middle, but you never know, right? And the scarier thing is you never know when you need it. Like they got a picture of an ambulance right here. Um, you might need healthcare at any point in time. You get in a car accident, or if you're playing sports and you just twisted your ankle the wrong way, or who knows, right? So it's something that you always want access to and hope you never need it, that kind of deal. But a lot of people, they're on like monthly prescriptions for their cholesterol or whatever.
Their high blood pressure,
Yeah.
or even diabetes.
Yeah. So like
That require numerous medications.
and they may not be a baby or an elderly person, but every month they're good thing I have health insurance. We're going after this. I don't know. Does anything come to mind for you just hearing that short bit?
I have so many thoughts on why I don't think it would work, but let's just hear what she has to say and then I can add to it just based on my experience with, Medicaid patients and Medicare patients. And
So I feel like there's a rant coming.
I mean, I don't know about a rant, but
I like rants.
I definitely have some things to add.
Okay, let's make that fire a little bigger. See what you come out with.
And it's not because they can't afford it. It's because available doctors simply do not exist. And you can't just walk into a clinic and ask for a doctor. They all have signs up that say not accepting new patients.
Wow.
Instead, you need to contact the government to be placed on a wait list. And in my town, you could be waiting at least 5 years. And if you're lucky enough to finally land a doctor, but that doctor is awful, which in a lot of cases they are, too bad. You get what you get. We do not have the luxury of choice here. Due to the extreme lack of family doctors, our emergency departments are extremely clogged. You could be waiting up to 20 hours or more to receive care. Because of the wait times in the emergency department, people are losing their lives. And unfortunately, this is one of the latest heartbreaking stories.
All right, let's see. The system is obviously broken, says NS man. I don't know where NS is. Man whose wife died in ER. Eisenhower for 37 waited hours to see a doctor at Cumberland Regional Healthcare Center. All right, so again, another article we could dig deeper if we wanted to, but I mean, if that's true, you go to the emergency room and you can wait up to 20 hours. That's like almost an entire fucking day. You could sit in emergency, like you don't have anything better to do, and not to mention you went to an emergency room. You might be having an emergency, and 20 hours is not emergency. 20 minutes may be too long. And I imagine it's not that dramatic. Like if I rolled up into an emergency room and I had 2 gunshot holes in my body, like I imagine I would skip some people. I'd hope, right? Like I know I've gone to the emergency room in America, and like I've waited like an hour and a half.
You haven't been to the emergency room lately, have you?
No, like that's not somewhere I like to go.
Yeah.
Like I would just rather avoid hospitals, but I've done it, right? I've experienced. There's a lot of people. It's like it's never an opportune time, but you go in there for a reason, and you gotta wait because there's more people trying to get help in some way than there's available staff and beds. So, I mean, I can believe that. And if we did have a government run system, I could see how it could be worse. Like I've gone to the DMV, waited for 2 hours, and left because it just wasn't worth it. You know, I'd come back at another time, try another day, maybe earlier, later, whatever, you know. And still, like that's my mentality when I hear about these socialized healthcare systems. But man, how mad would you be? You know, like think about if you were in their shoes and I was having some kind of chest pains or whatever's going on with me, and you brought me to an emergency room because I was sending some help, and we waited there for a really long time, and then I freaking died. Like, I know a weird other way around, I'd be pissed as fuck.
I would lose my shit.
Yeah, me too. I don't even want to imagine. That's so fucked up. Like, what's the point of an emergency room if you can't go in there and receive help in a timely manner because you're having an emergency? And the fact that she said, I think 1 in 5 people don't have a primary care provider. Like, you don't regularly see someone, or you can't at least schedule something. Like, the fact you have to go to the government to see what's available for you.
Yeah.
Like, that just doesn't make sense to me. Like, I really like the free market, and it's like, hey, if I go to this doctor and they suck, or I don't like their facility, or there's never any parking, or whatever the
Or
case,
they have a terrible bedside manner, or
I don't like them for any reason.
they
I'll
just
go down the
dismiss
street.
you, and oh, it's just hormones or anxiety, or at least as a woman, yeah, there's a lot of terrible things that
Yeah, you never
happen,
know,
and you can't
man,
change it.
that front desk lady or the nurse or the doctor, like, anyone could be having a bad day. Maybe you're having a bad day if there's something wrong with you. And if for some reason you just don't like the service at this clinic or this hospital, and if you live anywhere near an urban area, you just go to the next one. It's probably less than a 5 or 10 minute drive. To the next major, like, I think if we left the house right now, there's at least 3 emergency rooms we can get to within 15 minutes. Probably quicker than that, especially if we're having an emergency. I could probably get there in 5. Like, for real.
Yeah, no, I know.
We should test it. No. Yeah, so that's scary. That's what that is. Like, I have an issue with my body, and I can't help myself. I'm already going to be in pain, or I'm stressing out, and I'm scared, and I'm looking for a medical professional to help me. There's a lot of things that, even if you are a doctor, let's say we were both doctors. Maybe I'm a surgeon and you're like another type of doctor. I don't know, right? Maybe you're a pediatrician. And like, we have all the knowledge. Well, we still don't have all the tools.
Yeah.
Because some of the tools that these people use, like, there's millions of dollars of equipment inside an emergency room. Probably tens of millions, right? And you need that stuff. Like, we don't have a ventilator. We can't take x-rays. There's things that you would need to help someone and potentially save their life, because this is life-saving equipment. Like, I can't give you an EKG even if I knew how. Like, we just don't have that equipment. And I don't think anybody does at their private residence.
Yeah, no.
So you have to go to a medical facility in order to do these things. And if you can't, or even if you do go, you can't get help. That's scary as fuck.
Yeah, I agree.
You wanna say anything, or you wanna go?
I want you to go.
You wanna get through the whole video?
Kind of, yeah.
Okay, well, I'm gonna pause it again if she puts up something, because normally it stays up for like 2 seconds and I can't read it all.
If you ever need an ambulance, good luck, because we have a shortage.
Oh, that's nice.
And sometimes there's not a single ambulance available at all for my entire
Okay, sorry, something just came to mind. I thought once, because you can look at pictures, there's parts of Canada that are fucking gorgeous. And man, I saw this video of people skiing in Canada. I was like, dude, how awesome would that be if we could, like, drop the kid with the mother-in-law, and then, like, we hop on a plane, we go to Canada, we're skiing, we have a weekend, we could even get like a cabin somewhere and a hot tub, and it'd be so much fun. I don't want to do any physical activity in Canada, because
where you could get injured.
Yeah, if I freaking blow my leg out and then I have to fly back with a busted up leg just to go to the emergency room, you know what I mean? Fuck Canada.
Well, imagine having a real emergency, like, your kid is having an allergy, or your kid has an allergy. They can't breathe. Their throat's closing. The EpiPen is at used so-and-so's house. It's expired. It doesn't work.
I would still use expired one.
Right. That's why I added it doesn't work.
Okay.
Your kid's throat is closing. You're literally watching them turn blue. What do you do? Other than throw them in the car and race to the hospital and hope you get there in time?
Yeah. There's 2 sides to me.
Pharmacy and ask for a fucking EpiPen? Like,
Yeah. Oh, I got two ideas with that. One is what I would like to say I would do, and one what I'd probably actually do. What I'd probably actually do is have someone else drive while I'm in the back seat with them, trying to open their airway, like do the chin lift thing.
Mm-hmm.
And they're probably going to be freaking out, so I have to physically manhandle this child to try and get them to breathe while they can't breathe, you know?
By the time you're in the road on the car, probably already lost consciousness.
And then I'm trying to do CPR. I'm trying to save their life the best I can.
Mm-hmm.
But what I would want to do is take apart a pin real quick, take my pocket knife out, slit the throat, put it in there, put some duct tape around it, be like, breathe, bitch.
You watch too much.
Yeah, I know. That's what I'm saying. What I want to do. Because I watched, hey, look, I've watched that happen like at least 6 times on TV. Like, I probably could do it.
I mean, I'm sure there's,
but I don't want to try it on my kid.
YouTube video that'll show you how to do it.
Yeah. Maybe I should. No, I should not do that at all.
No, because then you would just do it and be like, oh, wait, you're still breathing? My bad, kid.
Yeah.
Of a million people.
Huh.
Have cancer or need specialists for other medical conditions? Good luck.
Lengthy wait times have some BC cancer patients dying before their first consultation. Oh.
Breast cancer.
How fast can breast cancer kill you?
I mean,
I guess you don't know if you have it. How would you know? You feel like a pain or something?
I mean, you can feel a lump or a mass. You can have other systemic systems, meaning other organ failure or fatigued, get sick.
They don't really know you have cancer. You know you have a problem. So you go seek help and they test you.
So, I mean, there are certain things like maybe that person didn't have a primary care provider. They had a family history or something, so they guessed maybe that was it, or they, did Dr. Google and they had some of those signs and symptoms and they assumed it was breast cancer. I imagine they probably had a mammogram that found a mass, and then, they can't stage them. They don't know what type of cancer. Is it invasive? Is it in the lymph nodes? Like what, anything else, a time frame, nothing other than there's a mass that they need to biopsy and determine if it's cancer. Well, if you're waiting 4 and 5 years and this is an aggressive form of cancer, yeah, you're going to be dead before you go to that appointment.
Damn. So for some cancers, you probably have no idea. Like, realistically, I could have cancer right now and not know it.
Absolutely.
But eventually it would cause a problem, and then I would go seek medical help for this problem, and then they would run different tests and figure out, dude, you got cancer. I'm like, fuck, I knew it. But you brought up the example of breast cancer, and maybe like one of the first signs or symptoms would be able to feel a mass or a lump or something like that, right?
Mm-hmm.
So to me, the best thing you can do for yourself or for your girlfriend, fiance, wife, significant other is to fill her up every day if you don't want her to die from cancer. I knew
exactly where that was going.
I mean, am I wrong though?
Mm-hmm. I mean,
actually,
monthly self breast exams.
Actually, I have a shirt, and I kind of wish I would have wore it. I didn't know we were going to talk about this, but I literally have a rebelshirt.com shirt that says breast cancer detector.
Mm-hmm.
Because, like, bro, I'm here for you, babe.
I know.
To save your life. But I didn't wear it because I was really excited about this one. If you're into the deer hunting or whatever, I got the camo deer silhouette, matches the camo hat. It says Rebel. Looks badass, don't it? I looked in the mirror, I was like, damn, that looks badass. So I know it does. Alright.
Anyway.
Anything else?
No,
let's go back to the Canadian girl.
Need blood work? Well, that's too bad because there are 0 appointments available. Need a psychiatrist? Well, that's too bad because there's a 2-year wait list. But hey, if you want medical assistance in unaliving yourself, the government is more than willing to facilitate that and will even suggest it.
What?
Pause it.
Alright, Michael Higgins, our veterans asked for help. They're offered assisted death. The dark road we're on with MAID, I guess that's one of their programs, is on the verge of turning pitch black. Okay.
BM seen in file photo from 2007.
That's Bruce Monker.
Yes.
Alright. There's a TikTok emblem in there, but had to have a something sent from his brain removed after being injured during Operation Medusa in Afghanistan in 2006. Ricker told MPS, that's another one of their systems. I mean, that's not the news network. This is MP. I don't know. On Thursday, that the state of veteran affairs has become apocalyptic. At least 6 veterans who have sought help from their federal department have been offered medical assistance and dying instead of. Okay, and it goes on. So basically, their system's so overwhelmed. Now, this is what she's betraying. I would like a second opinion, maybe look this up ourselves.
Obviously, it's hearsay, December 2nd, 2022.
But the fact that it's hearsay,
yeah, it's
like, sometimes
unimaginable.
People lie, right?
Yeah,
people straight up 100% lie. But a lot of times, even if you're hearing rumors or from someone who's not a government official or not a healthcare provider or something like that, there's a kernel of truth there. And it's actually not the first time I've heard this. It wasn't the deal with veterans, but I mean, you kind of put the pieces together. It's not completely unbelievable that a government-funded healthcare system that's completely overwhelmed would be like, hey, we're not going to be able to fix you, but it would be a lot cheaper to help you die. I don't know. I think I actually will look more into this because I think the idea of assisted death in America is a big no-no. When in some cases I actually would support it. Like if I know that I have stage 4 fuck you cancer and there's literally no way that I'm going to survive more than 6 months, but if I do everything my doctors say, I might actually survive 6 months in intense pain and suffrage. While I'm no good to you, my kids, like I can't do anything. I can't take care of the freaking lawn. I'm just suffering and hating life, and everything's miserable, and I make everyone around me miserable, and I'm racking up insane amount of debt that you got to deal with. I'll be dead as shit. Money don't matter to me. You're like, dude, why do that?
Just don't go over 400K.
Yeah. I see where you're going with that. I would like to be like, okay, let's stop all treatments. Give me whatever good stuff that comes in a bottle that I can pop 1 or 2, 5, 6 a day, and let's go on vacation. Let's have a week or two where we just hit whatever restaurant I want to. I eat whatever and how much of it I want to. We go see whatever movie I've always said, like, I'm going to go see that one day. And we go rent a sports car, and I don't even care, I get a speeding ticket. Fucking sue me. Like, I'll be dead, bitch. Like, just go have the time of my life for a couple weeks while I'm suppressing my pain and suffrage with whatever good juju the doctor's got. And then, like, I just walk into my appointment and, after having goodbyes with everybody, and I just go out on my own terms. Like, I'm for that. I can see how a lot of people would be against it, but it makes sense to me. And it's my life, right? I don't want to, like, do something fucked up. Like, I've never been suicidal, and I think suicide is kind of fucked up. Because someone's got to find your body, and it's most likely going to be your family member, and you're most likely going to be in a terrible state. You know what I mean?
Absolutely.
And that's their home. And what if they can't just financially be like, you know what? Fuck the house. The bank can have it. We're going to go live over here and never enter that place again. Most likely, they're going to have to try and call the cops, take care of your body, plan a funeral, spend bunches of money, clean the freaking house, and still have to live in it with that trauma. I don't care if like 10 years down the line, you're still going to have something back of your mind like, dude, my husband or my dad, they were right there in that corner when they did that to himself, or were hanging there, that blood splatter on the wall. Like, I hate the idea of suicide, right? And I would never want to do that. Like, everyone could be selfish, but that's like the most selfish thing to do in my mind. So I think assisted death is good in some cases, but here, in this case, if that's true, and Canada's like, yeah, bro, we're like busy, but if you don't mind dying, we'd actually help you out with that. That'd be a great help to everyone. You know what I mean? Like, I know you served your country, but if you just serve it one more time, dude, it takes like an hour. You won't feel a thing, I swear. You definitely won't remember shit.
It blows my mind.
Yeah.
That's like,
I'm actually going to look
Even
this up.
proposed as an option.
And that's not the first time I've heard about it. I just, you don't think that could be true.
Yeah.
I don't know. Ready?
Yeah.
All right. We're about 3/4 through. Almost done with her.
And that really is a testament to how well the system is working, that the government is actually asking us to unalive ourselves. Got to ease the burden on the system somehow, right? And another testament to how well our system works is how many Canadians have to raise money so they can go to the US for healthcare that they cannot receive in Canada.
Oh, let's see what it says. All right, Beachburg it says ONT, Ontario, mother in need of $100K to afford life-saving cancer. God damn it. That's exactly what we were talking about. A young mother in the Ottawa Valley is hoping to raise $100,000 in order to afford life-saving cancer surgery in the United States. So it kind of sounds like since it's socialized healthcare or socialized medicine, even if you got $100,000,
you don't have
I imagine it's illegal to bribe a doctor, right?
Yeah.
And if you have to go to the government, I'm sure it's like a website or an office, a phone number, hotline, some shit like that. Like you wouldn't even know who to bribe, even if you had the money in order to save your own life. So, oh look, we border this country over here that has a for-profit system, and we got some profit for them, and they can save my life. I mean, that would just make sense.
Mm-hmm.
Well, let's go take our passport photo and do fingerprints because Mama got cancer. That's crazy. And I mean, look in their furniture and like their house, and they got 2 kids. They probably aren't balling out of control.
Yeah, no. I imagine
that's gonna be their life savings and their kids' life savings.
Yeah.
Like $100,000.
They probably don't even have that in their life savings or kids' life savings. She's hoping to raise it.
Yeah, I mean,
meaning like they can't get a loan or sell enough stuff or
who's gonna give you a loan for? That's like the riskiest fucking loan.
I mean, true, but like you can get it for other reasons.
Okay, I see what you're saying. Equity on your house or some shit.
Yeah.
Okay. Man, that's just crazy, dude. I don't want it. Like I think our system has some issues, but that is scary.
Yeah.
Like I said, I could have cancer right now and just would not know it. But then all of a sudden, I get the message like, yeah, you're going to die. We can't help you. And if you did want to cross the border to go purchase help, that'd cost you about $100,000. I'd be like, fuck, dude. Because and I don't know about Canada, but I know the majority of families in America are paycheck to paycheck. I heard it a long time ago, but I want to say something like 60 or 65% of Americans can't afford like $1,000 emergency.
Mm-hmm.
And you got to think $100,000. Like the only way I could think of doing that for the average person is that hopefully they have paid off vehicles or enough equity in their home they could sell everything and live with a family member and still try to do a GoFundMe.
Yeah.
That's a lot of money. Even if you make $100,000 a year, you probably spend $100,000 a year. You know what I mean? That's a lot of money. All right.
If socialized medicine doesn't work in a country with 38 million people, how do you expect it to function in a country with 330 million people? I understand your system has its faults, but please stop listening to people like Bernie Sanders and AOC. They're nothing but snake oil salesmen selling a pipe dream. Socialized medicine isn't the answer for your problems. It's too expensive to uphold, and ultimately, it's a failed system.
Yeah. I agree. Can you imagine though? If they're having those kind of problems, like little under 40 million people, like basically California. You can look at it like that. The population of California, and that's how disaster it is. And then you want to do that with 330 million? It would be worse.
Oh yeah.
And I could think with the
people would be dying left and right before they even saw a primary care provider to get a diagnosis, much less, waiting for an appointment with a specialist.
Yeah, I love her terminology. If you want to unalive yourself.
That's what you got to call it these days.
Why?
I mean, I'm sorry, that the politically correct term so they don't get canceled or whatever.
I don't really believe in politically correct. I just say what you mean. I mean what you say, and that's correct.
I don't know.
All right, I get what you're saying, though. All right. Man, Canada's kind of fucked.
Yeah.
Oh, America. And there's a lot to be said. I said before, we got issues. Clearly, we got issues. But everywhere got issues. But our issues kind of seem tiny compared to some places.
Yeah.
That are also westernized nations, Hell, man. Proud to be American. Free market.
Yeah. Like, our healthcare system is already overwhelmed as it is. I mean, they don't have a workforce to support it, especially not in the hospitals. What is it, like 30 million nurses are planning on leaving in the next year or aren't satisfied with their job. They, don't get so much as a pay raise, or it's minuscule, 34 cents an hour every year, which doesn't even keep up with inflation.
That's not a raise. That's a slap in the face.
Exactly. They're overworked, they have forced overtime. They work in unsafe conditions. And this is just like hospital. Like, this doesn't even include like that preventative point of care, outside home primary care crap,
Or nursing homes.
I wasn't on the nursing homes, but those are terrible too. You might have one nurse to 30-something patients. Do you think your loved one is going to get any type of care that they need?
No, they're almost dead. Fuck them.
But no, our healthcare system is all kinds of fucked up.
No, yeah, I agree. But compared to Canada, we doing all right.
Yeah, that's because we still have a free market. We still have private insurance.
Ish.
You're right. But it's a not-for-profit profit system, if that makes sense.
Nope. It don't. At all.
So, as far as the healthcare system, a lot of hospitals, have the designation of being a not-for-profit hospital, right? So it's like tax exempt, right? The government did that in hopes that they would take this money they were saving and put it into programs for the people in the community. Bullshit. That didn't happen. All they're doing is lining their pockets, right? So, I mean, they're making millions and billions a year while they can't keep nurses to care for the patients. The systems are just falling apart from one end to the other. You go to the ER, even like here, right? I mean, I worked in the ER for 10 years? The longest wait time I think I saw at that time, maybe like 10 or 12 hours. Eventually, we might clear the lobby by the end of the shift or only have a handful of patients, right?
Damn.
And this is pre-pandemic era.
Yeah.
It's only gotten worse after, because a lot of people lost their jobs. They got government insurance money.
They didn't lose their jobs.
Okay, I'm sorry. They chose not to go back to work.
Yeah, because they had...
or got on disability and this, that, and the other. And so now they get health insurance paid. They got, stipends for X, Y, and Z, all that kind of stuff, right? So...
we should do an episode on COVID, because that was some fucked up shit.
We should. That would be very interesting. But the problem is, with an emergency room, a provider, at least at a not-for-profit hospital, you have to provide care to patients regardless of their ability to pay.
Yeah.
And so you can't bill them. You can't ask them for money at any time during their stay, technically. Insurance or no insurance. So patients don't want to pay copay or whatever, they'll go to the ER for their runny nose or their sore throat, and they're just bogging up.
That's not an emergency.
Oh, I'm well aware
You
of
go to
that.
Walgreens and get something over the counter.
They don't care.
Well, I guess if it's free, why would they?
The healthcare system has nothing in place to actually help in this case. They don't have enough nurses to care for the patients they do have admitted to the hospital. So they're holding patients in the ER. So they have very few beds that they're actually working out of for the patients who actually have real emergencies. You know, people are in the waiting room, patients are yelling at the front desk staff or the triage nurse or the people getting their EKG for reasons that they have no control over. And then more people are checking in behind them. And of course, there's a triage system. You know, you rank them from most likely to die to least likely to die. If you're going to die, you're going to go back before everybody else.
Go back to the room.
Yes,
Yeah,
go back to a room to be treated, assuming that we can do that.
Back of the line, like, you're about to die. We don't need you.
Not quite. But like, there's just like, we don't have the resources as nurses, and it's frustrating. And then as doctors in the ER, you know, it's all about the metrics and getting patients in and out and seeing certain levels in under so many hours. And, you know, they're trying to work them up from the lobby.
So they're focused on efficiency because it makes them look better somehow?
No, because it's how they actually get like reimbursed and paid.
The hospital?
Yeah.
Okay. So if they don't see enough patients fast enough, then they'll actually lose money. That makes sense. So it's not about the care provided. It's about the money from the government.
Absolutely. If you have, let's say, a stroke patient comes in, you have these metrics and stuff. They get a nice big fat check if you get that patient to either like a stent, you go to the OR and get a stent put in and get blood flow back to that area, or get them, you know, to another facility, a higher level of care for, you know, maybe they need to go and remove a clot and you can't do it at your hospital. Like there are like door to CT in, I think it's 20 minutes or something like that. Door to balloon in 60, door to OR 90.
Okay. OR,
anyway,
operating room, what is CT?
CAT scan. So you scan their brain.
Okay, what's balloon?
That's where they go in and they try to open up the area. It's a procedure to help reestablish blood flow.
Okay, gotcha.
And there's different types of those procedures.
Don't take me fucking 20 minutes to blow up a balloon.
They put a time frame on them, which is crazy. And if you went to like the ER today with these 20 and 40 hour wait times, because at least some of my colleagues are telling me, yeah, I mean, it's 16, 18 hour waits in the ER right now, you know, whereas it's 40 something over there. How long was she there? 36 hours and she died. It's just crazy. The people running the hospitals, the people running a lot of these healthcare systems don't even have a degree or have never worked a day in their life as a nurse or a doctor.
Don't have a degree.
A degree as a nurse, as a doctor.
Okay.
Like
they've never actually seen patients.
No, they're business and administration. Like
I mean, the hospital is a business. But it should be in the business of helping people, but they're in the business of helping themselves.
Yeah, exactly.
Like if I go to Walmart, I expect them to be...
And the government encourages it. I'm sorry.
Yeah.
The government encourages it.
There's a whole lot to unpack there. And you totally missed my joke.
What was that?
You said something about 20 minutes to balloon. I was like, it don't take me 20 minutes to blow up a balloon. I don't know how it's going to help save you from a heart attack. Anyway, that's funny in my head.
Yeah.
Anyway, there's a whole lot to unpack there, and I bet you I could let you go, and it was great. And you could talk about a lot of stuff for a long time. But I've been having this idea in my head, and to me it makes so much sense. And it's probably because I don't understand what the fuck I'm talking about. But to me, and why I say ish when you bring up for-profit free market style healthcare system, ishy, because it's not really.
No, it's so...
There's so many government mandates and regulations and intrusions, and just given a profit incentives for hospitals to run a certain way and to take certain patients and do things in a certain amount of time or file them a certain way. Like, we really saw that in COVID, which is why I think we should do a COVID episode, because, man, there's a lot of shit there. But prior to COVID, even, get the fuck out. Like, leave this market alone, and it's probably going to fix itself, because these places don't want to go out of business, right? They hire a lot of people, and a lot of people want jobs, and they want to get paid, and they want to do their job well. And that's literally why they went to school and still paying off these student loans, right? From the nurses to the doctors and everyone. So why not let it be free market? Now, sure, we need to regulate things like drugs, right? We can't just let, anyone make a drug and sell it to a hospital. There needs to be regulation. I'm not saying like just there should be no government investigation or
oversight.
Oversight.
But it.
Yeah, let the hospital run itself, and if it runs itself into the ground, then so be it. But stay the fuck out of the industry. Just make sure that it's operating safely, and that's it. So what I'm talking about is, I don't think that there's as much government involvement in the fast food industry, right? So McDonald's is going to base its business decisions off of what Burger King does. And Burger King's going to base their business decisions off what McDonald's does, because they're in direct competition for the same customers. And I think healthcare should be the same way, because they need to turn a profit in order to pay people, in order to do repairs on the building, or build that expansion to the building, or fix the freaking lights out in the parking lot. Like, they need money to operate, to pay their own bills, or to grow and expand, or open a secondary location, or whatever. They're a business. They just happen to be in the business of healthcare. So treat them like anything else. Walmart's concerned with what Target does. Target's concerned with what Walmart does, because they're direct competitors in the same region, right? That's how hospitals should be. So when I'm like, man, I just broke my wrist. I need to go to the hospital. They're probably going to have to put a cast on it, or a screw in it, or do something. I'm going to need stitches, whatever. I should be able to just whip out my phone with my good hand and see how much that costs, right? Maybe there's a test they have to do, or some kind of machinery. I need an x-ray, and I didn't think to Google that, but I should be able, like, if I want to go and get, I know, but let me get the whole idea out here. If I want to go and get a freaking burger, a double patty cheeseburger, I could whip out my phone and figure out how much that costs at this restaurant and how much it costs at that restaurant, because they sell very similar products. Well, hospitals sell services. So I should be able to look up Hospital A and be like, okay, well, what I think I need, me not being a doctor or medical professional, I think I'm going to need these services. It's going to cost me $800 at Hospital A. But over here at Hospital B, it's actually closer to my house, and it's going to cost me $750. I might as well go there. But they don't list a menu. They don't have prices for their services. They can't look up the wait time and, like, okay, well, Hospital A is seeing people about 45 minutes, and Hospital...
They have started posting their wait times.
Okay, well, fuck me. I'm wrong about that. But, you know what I mean? Like, I should be able to be like, okay, I want to have this service done, or I think I need this service done. It could be like, dude, I want to be on the sports team, but they say I can't play unless I get a physical. How much does a physical cost? Well, really, that determines on what kind of health insurance I got, and how much this hospital can argue with this insurance company, and what the government says that it can or can't be. And it's like all this shit that's shady and behind another closed door, or 17 closed doors, and has nothing to do with me or my physical.
Yeah.
You know what I mean? Or, whoa, I feel this sharp pain. Is it I need my gallbladder taken out, or do I have kidney stones? I don't fucking know. But I know there's a bunch of people in that building down the road that do. But, dude, I'm struck. What?
I was just looking to see if you were right.
It's somewhere in my body, okay?
No, I mean, like, right upper quadrant. That could be kidney stones or gallbladder. So good job, babe.
Yeah, thank you. Point being, why the hell is it so convoluted, confusing, and fucked? Like, there should be a price for service. If I call my plumber and like, dude, I want this sink put in my bathroom, old sink taken out, new sink putting in, or I want my shower head has awful pressure. I think I need to have my bathtub remodeled. Like, I can literally on the phone call this company and get a quote. Especially they might ask some questions like, well, what's your square footage, or what kind of blah blah blah. But I can get a general idea. I can even ask my neighbor, like, hey, when you did this, how much did it cost you? Well, this plumber quoted me this, and that plumber quoted me that, and then I went with that company because, hell, they had a better price. Why can't I do that with doctors and hospitals? Like, it just makes sense. That's the free market. I'm the consumer. I'm going to pay the money. I get to choose where I want to receive my services and products from. And if you have an insurance company, they're like, I'm paying every month just in case I need you to cover these things because they cost a lot. But that's so fucking convoluted. Like, the hospital says we're going to charge you $10,000, and the insurance company says we're only going to pay $7,000, and somehow they meet in the middle. That's so fucked up. Like, how do we even get to that point? That's my view on it.
You will never receive an itemized bill from a hospital unless you request it and even threaten to get a lawyer involved.
Okay, and even if I did, let's say me and Joe Blow went to the same hospital, maybe 3 weeks apart, and got the same shit done, and we both requested itemized bills.
You're going to have different fees and charges.
Right? That don't make fucking sense.
Because
the same people did the same thing. We should have the same price.
If you have insurance, they're going to charge you more.
That's so fucking retarded, though. Because, like, me and Joe Blow can go to Walmart 3 weeks apart and pay almost down to the freaking penny the same price for a gallon of milk. You know what I mean? That's the way hospitals should be.
It's price gouging at its finest.
It's fucked up.
It is. It is absolutely, irrefutably disgusting.
Because we're literally talking about life and death, or at least quality of life.
Yeah. No, I mean, I fucking agree. 100%. 100%.
So why do you think that is? Do you think it's just because hospitals are greedy, or insurance companies are greedy, or government involvement, or all three?
It's a combination of the three.
And that's our healthcare system.
Yeah.
And while it may be better than Canada,
I don't think it's going to fix itself regardless. It needs a complete overhaul.
And I think it starts in Washington.
Absolutely.
Not that I'm a politician, or I'm not in the administration of a hospital. I'm not a doctor, and like, what the fuck do I know? I can see bullshit. I got a bullshit meter, and it's pegged the fuck out on the healthcare system. And we don't need socialized healthcare. We don't need government hands out.
It a million times
worse.
We
need free market, because free market works.
ER now. Imagine if they had socialized healthcare here, or if we had socialized healthcare in the United States. Just on average, if I refer a patient for mental health services with insurance, government or otherwise, it takes some time to get in and schedule an appointment. A couple months, maybe.
Couple months?
If you have Medicaid, most providers, at least mental health providers, don't even accept Medicaid insurance because they don't pay crap. They pay like next to nothing for mental health services. It's almost like a slap in the face for people who actually have real problems. But regardless, besides the point, they pay absolutely nothing, and these people lose money and time, so they just quit taking it. 6 months to a year for a kid to get evaluated for autism spectrum disorder. Can you imagine if that was your kid? And
I'm pretty sure I could tell if you had autism or not.
Beside the point, you have to get special services for your kid, to get, the government to pay for, whether it's speech therapy, occupational therapy, home services, to pay for some of the medical bill, like things like that, to get schooling, to get those accommodations that they would need, or to get into a certain school, you have to have a diagnosis.
Okay, so if there's a system ran by the government, it'd kind of be like in Canada.
Oh,
And
absolutely.
you'd be like, okay, I think my kid needs this. We need to look into it. I need to set an appointment. You
Even
call
if your doctor said they need it.
Okay, so you have a referral, and you call the people for an appointment, and they're like, okay, it's May 5th, 2023. Let's see what we got here. How does June 7th, 2027 sound to you?
Oh no, you
Fuck,
don't even
dude.
you don't even get a date. You get put on a waiting list and you hope for a call. I'm not even kidding. It's ridiculous.
And I trust them to call me back, even if I got to the point. So I did watch this one video where this lady was talking about how she called 8 times, finally got through. The lady said it'd be a 10 to 15 minute hold, put her on hold. 35 minutes later, she hung up. Like, that's even if you can get to the point where you talk to a human. And that's the worst thing, man. The only time that I'll do business with a company is if I absolutely fucking have to. When I talk to robots for 10 minutes. Like, I want customer service. And it's not like I'm a Karen, I'm demanding the world. I just want to Google a phone number, call a phone number, and talk to another human being.
Yeah.
Things are so much more efficient that way. So if there is a company that, when whatever business they're in, if I need that product or service and I call them and they answer the phone, I don't care if they even charge me more than their competitor. I want to do business with them because I know if I need to call them, they're going to answer their phone. You know, I don't need an account number that I never fucking knew and definitely don't remember. You know, I need to type in my birthday and last four of my social and wait in this shitty music for 10 minutes just to find out that, you know, they're going to put me on hold again. Like, I hate that. And that sounds like the whole healthcare system in Canada. Just, you might lose your life.
Yeah. So, for example, primary care. So that's, you know, you have a cough or a runny nose or a splinter in your foot.
You got the flu.
Yeah.
Sprained your ankle.
Okay. And then preventative care. So that's your well visits, right? If your child needs immunization so they can go to school, or, you know, they need a physical so they can play sports for this team, whatever the case.
Normal stuff.
Or you're an adult and it's time for that, your annual lab work, and to make sure, you know, like you're over 50. Oh, well, I need to go get a colonoscopy now. Whatever the case, right? Yeah, I know. So, with government and reimbursement, it's bullshit, right? So you pay the government, or I say you and I, everybody pays taxes, right?
No, they steal that shit. Before I get my money, they get theirs.
Yeah,
and it's not by choice.
Yeah. Anyway, so government healthcare is funded by the state and the federal government. So you and I are paying for it already, even though we're not receiving it, whatever the case, right?
Yeah.
So the government reimburses clinicians, and this is why a lot of those companies or specialists and all, like, only take a certain number of Medicaid patients, or don't take it at all, or some of them even stop taking insurance altogether because it's a broken system. It doesn't matter if I spend 5 minutes with you or 5 hours with you. I get paid the same.
So you want to spend 5 minutes or less. It's what your time's worth to you, and you got other patients.
Yes, assuming you own the clinic. I don't own a clinic. I work for one, and I am not necessarily like money hungry, or, you know, like,
you have no incentive. You get paid the same.
Yeah. But it's also,
hold up. Is your little clip or something rubbing on the table? I keep hearing that.
Oh yeah, probably.
Clip it to your little heart there.
Yeah.
Looks great. I'm gonna do the same thing. Clip it to my deer feet.
So
Boom.
get paid the same, right? In a rural health clinic, so these are the, country areas or not urbanized areas, whatever, where you might have 2 or 3 providers in that city, if you're a rural health clinic, you get one fee for all visits. Like, you can't turn away Medicare or Medicaid patients.
And if you do?
Then you can't receive funding from Medicare or Medicaid for any patients. They could report you. Like, if you accept Medicare or Medicaid as a rural health clinic, you can't turn away. So, like, unless it's, within so many minutes of closing.
So you either follow by their rules and take those patients, or you don't.
Right. But the thing about that is, let's say you have Medicare or Medicaid. They provide transportation. They're never on time for their appointment. So you have a patient that's coming in for a well visit. Let's say it's an annual Medicare visit. Those take so much time because you have to check all the boxes and cross your T's and dot your I's just to get reimbursed for that visit. So again, like you talked about earlier, like invasion of privacy and like all that other stuff. Do you have rugs in your home?
The hell does that matter?
Falls risk.
Falls risk?
Mm-hmm. You have to assess.
If I have a rug in my house, I might trip on it and fall.
Uh-huh.
And what if I do?
Do you have handrails in your bathtub?
No.
But like those are like, and you have to ask those questions.
You ask people that?
I mean, there's a checklist and they volunteer the information. If they didn't check it and it's required for the clinic I work at to get reimbursed for this visit, then yeah, I'm going to ask it.
So why do you even do it?
Because patients need care. These patients a lot of times can't get to X, Y, and Z, or maybe even if they don't use Medicaid or Medicare transportation, like they don't have gas to get to the city to go see so and so or another doctor elsewhere.
So they're poor.
Yeah, a lot of them are poor. They're on Social Security. They're on a fixed income.
So
they don't have a choice, really.
Go to places that accept government insurance or government health care, or they
don't go at all.
And it kind of sounds like maybe even if the facilities that accept Medicaid and Medicare, they can get appointment there, the health providers themselves are almost incentivized to do the minimum.
Exactly. Of course they are.
So even if your health care is free, it's almost guaranteed it's going to be the lowest quality. Yeah. You get what you pay for.
Essentially, it's going to cause a significant or further gap or decline in access to care for patients. Because if you don't get paid to see patients, and now we're, on this government-run socialism healthcare, those providers aren't going to go to those areas. They're not going to go and take care of these patients, that they're only going to get X, Y, and Z.
Yeah, they're going to go practice.
To their own practice
and
with
go
a cash pay system or this, that, and the other. Like, there's no incentive for providers because the insurance companies and the government, they want to do anything and everything they can to pay you as little as possible. You can't, if you address a sick problem during a well visit, you don't get paid for both. Like, you don't get paid for that time because a well visit, takes X, Y, and Z. You can't bill for both. They're only going to pay you one fee. So you're either
But you could have private insurance.
Yes.
Okay.
So you could say, okay, you'll have to come back for that. Or you can choose to treat their cut on their hand that looks like it might be getting infected and to prevent them losing a finger if they have diabetes, or some.
So playing by the government rules and still trying to be a profitable company, so you're still in business and don't go out of business because you're not helping nobody. You kind of have to make some compromises.
Yeah. And either way, it's all going to affect the patient in a negative way. They're either not going to be able to get an appointment, they're not going to be able to receive adequate and proper care. The caring physicians out there are going to go and do something else because they're just a cog in a wheel.
It's a headache.
Yeah. I mean, there's a lot of systems that will try to schedule providers appointments every 15 minutes. Every 15 minutes. But can you imagine, like, having a question about something and, the provider saying, "I'm sorry, we don't have enough time for that today. You'll have to come back." Or just saying, "Oh, go read about it. Here you go." They don't have the time to even answer your questions. If they do, there's patients waiting 2, 3, 4, 5 hours to see these people, because they literally, they don't. The system is fucked up.
Mm-hmm.
It is. And I don't have an answer on how to fix it.
I was just about to ask you.
Get rid of it and start over.
Yeah, I feel like that's a solution to a lot of things. But with the healthcare system,
there's
and acknowledging
too many
my lack
and government involvement and all of these hands that are in the pot or stirring the pot or want a piece of the pot, that there's no way it's going to fix itself, like you had mentioned earlier. It's literally going to take just
crumble it all up, throw it out the window, get some new people in charge, fire them fools, and let the private insurance companies battle out for the most care you can offer your people with the smallest payments. Like any other industry. Like if you had a Honda dealership, and so did I, and you were selling your Hondas for $10,000 more, you're going to go out of business, and I'm going to be making a killing. You know what I mean? So if we were both private insurance companies, like, we have the potential to sell to the same amount of people, so I'm going to try and offer them the most that I can, still turn a profit on at the cheapest price. And then those people obviously win because they're able to go and use that insurance to pay these health providers at any facility and get decent care, because these health providers are trying to give them the best care they can, and they're getting compensated for it. Because I can totally understand that we need something, because most people don't have the cash to pay for healthcare, because healthcare is expensive. But healthcare would be a lot less expensive if the government wasn't in it and the insurance companies weren't dealing with the government as well, and they were able to compete directly with one another, right? And honestly, I don't see why medical providers can't provide a freaking menu. This is our capabilities. This list right here is everything that we can do for
we can do that for clinics. It's hospitals that don't do that.
Well, them too. Why should they be any different?
I agree. And
I think it's because they go back and forth. Like, I heard this one couple, the husband had to go to the emergency room for something, and they didn't have insurance. So after they got a bill, right? And he called to talk about maybe a payment plan or what he could do about this bill. And he told him he didn't have insurance, and the hospital wrote it off. But then down the line, they had insurance, and the lady got in a wreck, right? The wife got in a wreck, and then she went to the hospital, and she had some medical care provided to her, and she had insurance, and they wouldn't write it off, and they obviously charged the insurance company. So it's kind of like, well, I know that the service they provided to the husband wasn't free. That cost the hospital money. right? But the hospital can gouge the shit out of prices for the insurance company. They can battle it out for money exchanged.
Mm-hmm.
It just seems like a counterproductive game there. It's literally a fucking game.
Yeah.
And I think the core issue is, how do we help people? That should be, and I really think most healthcare providers want to help people. Right? They're the one interacting
I
with
imagine
these patients.
that's why they got into the healthcare field.
Yeah. Yeah.
And they're
Not to
getting
mention you
burnout.
can get a job anywhere and you make a decent living, but some places treat those healthcare workers like liabilities. Like, this is an outflow of money. So if we could reduce the number of staff on a given shift and make them work harder and longer and more, like, that's a positive, that's a good thing on our ledger. You know what I mean?
Mm-hmm.
But it creates awful care, an awful environment, awful place to work, you know?
Yeah, it doesn't matter how good your doctors are if you don't have the nurses to actually carry out those doctor's orders and to give the medications and to make sure that
regardless
your
of your
diaper
job
is changed at, well, no matter what age you are. Like, it is shit in a handbag, whatever that saying is. I don't even know.
I don't know. I've ever heard. What's a handbag? Like a purse? Why are you putting shit in it?
I don't know. Something along those lines. Anybody, feel free to comment and tell me exactly how that saying goes. But that's what I'm trying to say.
No one watches this show. This show's a shit in a handbag.
Stop. One day, who knows?
Yeah. Actually, speaking of that, we are growing as of right now, and maybe hopefully that'll change by the time I upload this video, because we do try to upload them a little bit ahead of time, because I like to put episodes out every Monday, and I feel like if I can keep that consistent schedule, then we do have subscribers and they know what to expect from us, and to give something back for anyone who enjoys the show and watches it. If you are at all interested in rebelshirts.com, using Rebel10, Rebel10, then you can get 10% off at rebelshirts.com.
Get you a rebel hat like that.
Dude, this hat is cool as fuck. Actually, I got headphones on, but in the back it actually has a metal clasp and a little metal slot for you to put your excess little sizing band there, your strap. And it can make you look as good as me. I don't know how good you think that might be, but
fantastic, babe.
Anyway,
fantastic.
All right, commercial. I think it's the second commercial today. I talked about my shirts earlier.
Oh yeah.
Yeah. Anyway, so shit's fucked up. We don't have the answers, but we can definitely drink about it. And I'm about done with this one. Do you think we're about close to calling it a day, or going to a bonus topic, or you want to take a break and take a potty break and
that sounds
refill?
Fantastic.
You want to take a break?
Yeah.
So you got more on this topic? I'm gonna come back to a bonus topic.
I mean, yeah, I could continue to talk about this topic, or we can go to the bonus topic. I could, complain all day about healthcare and the government. And
I actually found that interesting.
How it makes,
because you actually know, you actually have
life so much harder.
Yeah, you have some experience with it.
Oh, you know what I didn't say?
Oh, let's say it. What?
So,
you have any guess?
For example, we have to, let's say, a patient needs imaging or an x-ray or this, that, and the other, right?
Yeah.
So they come to their primary care provider or me.
Referrals.
Well, that's part of it. Referrals and prior authorizations. So not only does the government, at least here, require a referral to go see a specialist. So you have to schedule an appointment that they're paying for to get a name and number and your stuff sent over to another doctor to go see them. So instead
you can't just go directly to them.
No. Even though it was recommended, let's say you went to the ER and they said you need to go see so-and-so, follow up with your primary care provider for a referral.
Okay, so let's say I was trying to show my kids how to ride a wheelie on a bicycle. And then I fucking slipped up, you know, because I ain't done that shit in 17 years. And I broke my foot. So I went to the emergency room. It's like, I don't know, let's say it's 7:30 p.m. and my normal primary care provider is obviously off and it's a Saturday and I can't go see them, so I go to the emergency room. It's the most logical place to go. And then they help me as much as they can. They're like, obviously you need to have a follow-up visit, but you're probably going to need surgery. You're going to need some kind of screws put in and have this redone. So you're going to need surgery. And we can't do that here in the emergency room. But in order to go to your specialist foot doctor, you have to go to your primary doctor. So to get an appointment with them, you probably got to wait at least 3 days, a week, or whatever. And then they'll be like, yeah, your foot's fucked, dude. You need surgery. So then I have to get a referral in order to make an appointment with the foot doctor surgery dude. And that might take a week to get that appointment. So now I've been having this fucked up foot for at least 2 weeks now and had twice as many appointments as I should have had to go get the surgery. Otherwise, I come out of pocket. And I can't afford foot surgery.
They won't even let you schedule an appointment with a specialist unless you have a referral in their hands with Medicaid.
Yeah.
You can't call the doctor and say, I broke my ankle. I need an appointment or whatever you think is going on. And I mean, I can see why in some cases that could be an issue because anybody could call up and be like, yeah, they told me I had to see a neurologist. And really it's like neurosurgery or something because you got a spine issue because, not everybody is.
Common sense.
Well, no, not everybody's knowledgeable in medical terminology and understands X, Y, and Z.
That does make sense.
But the fact that you have a provider that says on your paperwork and they'll give you a name and a number to go see whoever of that specialist, but you still have to go see your primary care provider.
Yeah, that don't make sense.
Send a referral.
If I in my scenario, I broke my foot trying to pop a wheelie on a bicycle, like a jackass, and I go to ER and a doctor says you need to go see this other doctor at this place. Here's his name and number. That's a fucking referral. That doctor just referred me to another doctor.
No, but they didn't send that information to that other specialist.
What? What information?
The actual reason for the visit, your name, your phone number, your insurance information, your whatever front cover page, data sheet, I forget what they call it.
So why can't I get a referral from any doctor? Why do I go to my primary care? What if my primary care is on vacation? He's in Bahamas for 2 weeks. I got a broke ass foot.
I mean, I imagine that they would probably get someone else in that office to send it. But essentially, the primary care provider is the point of care, the access person. They would be who's going to continue things. Like, for example, you see a cardiologist, they put you on carvedilol or blood pressure medicine or whatever the case. And you take that the cardiologist sends you their notes so you know what they're taking, why they're taking it, and you only see them every so often. So you know what's going on. You know what's going on with that patient and why they're taking that medicine, what the official diagnosis is. So in the event that something happens, you're aware. So instead of a person having
so the ER doctor's not going to go that in depth in your medical history, but your primary care should.
But we don't have the time.
Who don't?
The primary care provider does not have the time.
Because they got 15 minutes with you to the next one.
Mm-hmm.
I mean, yeah. Fuck, how do you fix that? Yep.
Exactly. Overhaul. Get rid of it.
Okay. Let's say you are queen of the American healthcare system. And you have to go into great detail. But you just crumbled up our current system. Just delete it. Gone, bye-bye.
Yeah.
What do you do?
So,
Oh, and by the way, while you're deleting that shit, remove the fucking requirement and the fee for not having health care.
Yeah,
'Cause
that's a whole nother.
bullshit. Oh my god, that pisses me off. Like, what if I'm 24? I'm healthy as fuck. Dude, I can run a 6-minute mile and I can lift twice as much as you. And you're sitting in some office and you just signed a bill that makes me pay you, the government, for not having health care?
Again,
Fuck you, bruh.
they
That's so
want their
fucked up.
hands in all the pots. So
So-
we pay taxes to state and federal governments.
Mm-hmm.
Taxes fund healthcare. They have
I'm 24.
yeah
I
no
just got out of college. I ain't got no fucking $400 a month for health care. But I don't fucking need it. I'm 24. You can shoot me, I'll heal tomorrow.
Yeah.
Like, I'm not high risk, right? And if something does happen and I have to get medical care, then it's on me, right? That's a personal responsibility decision there. Or hopefully my parents can help me out or whatever the case. But you're going to make me pay you because I can't afford health insurance? That don't make any goddamn sense. What the fuck? I can't afford health insurance. I can't afford to pay your fee. I'm trying to put my life together, dude. I'm trying to, like, get my car out the shop so I can make it to work and pay my rent while I finish school. Like, whatever. Like, I'm barely out of high school here. I don't have the resources to be paying for health care or because your system's fucked, right? Or paying you a fee because I don't have health care because I can't afford it. So now I gotta pay. It don't make sense. Makes me mad. Like, that was there at one point in time.
No, I know.
I went and got my taxes done. I think it was H&R Block, and this sweet old lady did my taxes and was like, "Hey, you're doing pretty good," and blah blah blah. She's, we're having our normal conversations about my income and how much this form is going to cost, and obviously I don't know shit about taxes. I was like young 20 something, and she's like, "You don't have health care? You're gonna have to pay $650 because fucking Obamacare. Like, I gotta pay $650 in taxes because I don't have health care. How's that work? Like, what the fuck? Why am I paying $650? I'm perfectly I'm 20 something years old. Like, I'm in great health. I can go eat a large pizza and run 2 miles backwards. You know what I mean? Like, not today, but like, you're fining me for not having health care? If I get hurt and need health care, isn't that a me problem? Not a you problem? I don't understand it.
I have no idea. Just, again, another way that they're getting money and charging you more because your taxes are already paying for other people's health care.
Yeah. Like I said, the government literally takes money out of my paycheck before I get it. And then they're going to fine me again. I bet you if you didn't take my taxes out, or at least not so much, I could probably afford some health care. You know what I mean?
Yeah. And then they're going to, what was that video we watched earlier with a lady that I think she made like $31,000 and
yeah, she said she she was a California resident.
Yep.
And she made $30,000 a year, and she worked 2 different jobs, and she's a full-time student. And I mean, that's pretty good. If you're a full-time student making 30 grand a year, like, girl, you're doing great. Keep it up. But she got charged because she didn't have health care. And for some reason, she couldn't be on her family's plan. Like, I think you can be with Obamacare, you can be on your parents' plan until you're 26. For some reason, she couldn't. Whatever. I'm sure that happens to millions of people, millions of kids, right? I mean, like, sure, you're an adult. You're probably 22, 23, but, like, kind of a kid. You're still in school, right? You don't have a career.
Yeah.
You don't have a family. Like,
so she made
that's a
too
lot
much.
to budget.
She made too much to qualify, And then on top of that, they charged her a fee for not having health care.
Well, 30 grand anywhere is not too much for shit, especially California.
No,
Like,
you can't even afford
the smartest
rent.
thing she could do is quit both her jobs and school and move somewhere free. You know what I mean? Like, you have better odds, especially with a work ethic like hers. If what she said was true, and she's really working 2 jobs and in school.
Yeah.
But to her point, yeah, I think it's fucked up that you're getting fined by the government because you couldn't afford to support yourself, put a roof over your head, eat, put gas in your car, make it to work, make it to school, do all the things you're doing, and pay for health care. When honestly, if she's that young and she seemed like she was healthy to me, like, you'd probably be paying way more than if you would have paid out of pocket for whatever you really needed. If you're not on any monthly medication and you're not like racing dirt bikes or something crazy, you probably could go a year or two without ever seeing a doctor and be perfectly healthy. Like, I'd recommend going to a dentist, getting your teeth clean, but why go to a doctor if the worst you get a 24-hour stomach bug, or you get a headache every now and then? Like, you don't really need to go to a doctor. But you have to pay health insurance or you have to pay a fine. That's your only 2 options. I just think it's fucked up, man. But I think we're kicking a dead horse at this point.
Wait.
Okay, go ahead.
I still have to add about my prior authorizations.
Oh, yeah. Tell me about that. Who's going to prior authorize me?
So, insurance companies, and this goes for all of them, not just government-run insurance or government healthcare.
Yeah, even the private ones.
Wait, what?
Even the private
yes.
insurance companies.
So, as a primary care provider, you order an x-ray or lab work or whatever, you provide a diagnosis code. It's not covered. You have to get a prior authorization. So, the insurance companies have say, okay, yes, you can have this test done. So, they're delaying care, right? Let's say I ordered a CT of the abdomen and the patient isn't dying. I don't think it's an appendicitis, I don't really have a, like something more to go on.
Diagnosis?
Yeah. Like, I mean, they have pain. It's been ongoing, right? I don't have the lab results yet to know if they have abnormal labs. That gives me a better idea of where to look, but it could be X, Y, and Z.
You have a machine to look inside their body.
Yeah.
And then they'll give you a clue to something else.
CT not approved. Try an ultrasound first.
Because it's cheaper?
Yeah.
But what if that don't work? And then you still got to pay for the ultrasound and the CT now.
That's my point exactly.
That's stupid.
But usually it's X-ray, ultrasound, CT, MRI. To get as a primary care provider, it's so hard to get an MRI approved unless they're like stroking out or they're having like spinal cord compression where they can't feel their legs or like they can't walk or like something crazy. You know what you have to do before you can get an MRI of someone's back who has like known degenerative problems and neurological deficits, meaning
I have no idea because I don't even know what that is.
Well, if you would let me finish.
Sorry.
So, neurological deficits, right? They have weakness, decreased sensation, numbness or tingling. They're peeing and pooing on themselves.
No decreased sensation below my waist.
Whatever. There's something going on with the nerves, right? In the extremities, whether it's the neck, got the arms or the low back with the legs. So you suspect that, maybe they have a bulging disc that's putting pressure there. It's intermittent, inflammation can cause it to be worse and this, that, and the other. They have a history of bulging disc. Maybe they had a previous spinal surgery. They're having this pain that requires advanced imaging, so CT or MRI. You get an x-ray. It's not going to show anything. It only shows you bones, right? But you got to get that first, right? And then the patient has to fail oral medications. They don't work. The pain doesn't go away, comes right back. And they have to fail 2 weeks of physical therapy before you can get an MRI approved, if as a non-specialist.
All because the insurance company doesn't want to fork the money for a CT.
That's mainly MRI.
MRI. I don't even know what a CT is. CAT scan?
Yes.
What's the difference between a scanning a cat and a RMI?
magnetic resonance imaging.
Yeah.
So an so X-ray shows bone.
Yep. Familiar.
The ultrasound shows some more like soft tissue kind of, but it's more similar to an X-ray.
Yeah, you got one when we looking at the baby.
Yes, right. So you can see the things move, you can see the heartbeat, you can tell if there's a hollow mass or a not hollow mass. What's that word? Anyway.
Yep.
Like you can look at it
non-hollow masculine.
Like an abscess if it has fluid in it, so you know if you need to cut it open and drain it. Things like that. It's a little bit more in depth.
So it has a purpose, but we have to go through these steps because of money that they don't want to pay out, even though in order to have health insurance, you have to pay them monthly. Mm-hmm. They're going to make you, who you and your doctor agree that you need MRI, go through all these steps, and they take weeks, I'm guessing?
Maybe months.
Months? And you're dealing with this thing when your doc's like, dude, you need an MRI, but we have to do this other shit first.
Yeah.
Which costs insurance money, more money.
And the best part about it is a lot of times they won't approve it if a primary care provider orders it. They still have to go see the specialist and have the specialist order it.
Dude.
It's insane.
Yeah.
And it's a waste of money and it's a waste of people's time. And I understand the logic behind it because some people will just order anything and everything and they don't need it.
Who? Don't doctors order it?
Doctors and nurse practitioners and things, but like if they just fork the money over for it and they didn't have to go through all the steps, then they're going to be more likely to order it.
All right, so
if that makes sense.
I guess the only thing I think of is that
people who don't.
If this healthcare facility, maybe you have one doctor in it, maybe you have 6 doctors in it, whatever, and they all get together like, dude, if we just charge all these insurance companies from our patients for the MRI, we'll make this much more a month. So the insurance companies make the patient go through a bunch of hoops to protect themselves from greedy doctors?
Maybe not necessarily greedy doctors, but from maybe not the greatest doctors or providers, because there's PAs and nurse practitioners and DOs and MDs and da-da-da.
So we're just assuming that these people are trying to make the most money from the insurance companies, so the insurance companies make policies that you have to jump through all these hoops just to make sure that the insurance company's not getting fucked by the doctors. Whether because they're greedy or because they're stupid. Either way.
The doctors don't get any money from the insurance company.
Well, the insurance company's paying somebody.
Stop. The doctors don't get any money for ordering that MRI unless they have some kind of stake in the company, which is illegal. You can't do that.
So the hospitals would encourage the doctors to charge their patients for these more expensive procedures to make more money for the hospital itself. So the insurance companies were like, hey, before we pay for that, do all these other things and see if that can solve your problem.
Potentially, yes. But I think it may be more of like the provider doesn't know that they actually don't need an MRI for this. And that, like it's a combination of the two. So maybe you have a new provider that's ordering an MRI, for God knows what, on an extremity because they think they have a blood clot. Well, no, you get an ultrasound for that.
Okay. Well, how about this?
Like, that's what I'm saying. Like,
I can solve this.
I can see where maybe.
No, I can solve this.
Yeah. What's that?
How about, and what do you think is like one or two of the most popular private health insurance companies? Name one.
Blue Cross Blue Shield.
Okay, that's the only one you know?
Aetna, United Healthcare.
Let's say Aetna, Blue Cross Blue Shield, they're each having this problem that in this city they have Hospital A. And Hospital A seems to require their patients to get like twice as many MRIs than this other hospital in this city. And they're like, well, that's weird. Like, why would all the patients need MRIs go to Hospital A? Well, let's look into this, right? And since this hospital directly works with this private insurance company, then they should set up a meeting to review all these patients and all these MRIs over the past 3-6 months, whatever,
And who's
and
ordering them.
and yeah, and determine like, hey, we're suspecting y'all of trying to fuck us and get as much money as possible out of our company to support your hospital, and is not required for the medical care of your patients. And then that company can just choose to like, hey, hospital A, stop this, or we're going to stop doing business with you, right? So our patients are going to stop coming to you. So if this hospital's being shady, one, we're not going to pay you, and two, we're going to let our patients know that we're not going to do business with this hospital. So you're going to have to go to hospital B. So all of our patients are going to go to hospital B because that's the only ones we work with. So that hospital is going to lose that money. And if INMA is doing that, and Aetna is doing that, and Blue Cross Blue Shield's doing that, right? Because the private insurance company is not trying to lose money, right? But the hospital is not trying to lose money. So giving them the power to control who they work with and don't work with, they'll both try to be honest for the patients, right? You laugh, but that's private business at its finest. No. Because if I had two suppliers, let's say I sold bags of corn, right, to farmers to feed their cattle, and I sold it to this farm supply shop A and that farm supply shop B, but farm supply shop A was calling me back and be like, hey man, half your order came either busted or rotten. And I'm like, man, fuck. And they did that multiple times, but I never heard that from B. I'm thinking, I'm using the same shipping company to ship to A and B, so I don't think it's them. But yeah, I'm going to call them and just ask them about it. See maybe if their driver's doing something or their trailers need maintenance. I'm going to try and look into this, right? Because I'm having to refund shop A for my product showing up there fucked up, right? But then I'm like, man, the shipping company's doing the same exact thing, or maybe they're my employees that are shipping my product to these stores, right? So I look into it, I talk to these guys, I talk to their managers, and like I'm looking at the trucks and the trailers here, and like the roads seem to be in the same condition. I can't figure it out. That's going to lead me to shop A is just claiming this, yet selling all the product I sell them at a premium price, but I'm refunding for half of it. I'm going to stop selling my product at product A. And if they're doing that to me, they're probably doing it to people that are supplying them with other products too. And eventually, people are going to stop doing business with them because I'm not being able to turn a profit doing business with them. So I'm done with A, and I'm literally doing all my business in that region with B. Like, people that are in business to make money, they're going to try and make good decisions for their business. Now, my scenarios may be fucking crazy, corn and farm supply shops, but it's the same thing with private insurance and hospitals. Like, if I see a problem here, I'm going to investigate it and make the best decision for my company, because I got to pay myself, I got to manage my business and my employees and pay them. And I'm trying to build a business and turn a profit. And if someone's fucking me, I'm going to figure that shit out. I'm going to stop doing business with them because it'd be stupid to continue.
I agree.
What ultimately happens is that the customers at the farm supply shop or the patients at the hospital are going to wind up with lower prices because these companies are working more efficiently and they're not inflated, and we're arguing over make-believe prices. That's why the farm supply shops are probably
you need another drink?
Yeah, the farm supply shops are going to have a listed price. Like, hey, we're selling corn at this price, but B also has that same list price, and they're competing with each other, right? And they're both getting their corn, or at least my brand corn, from me, right? So everyone's trying to do business as less shady as possible, so we can all.
In a perfect world, babe. In a perfect world.
I get it, but the free market regulates itself, right? So like Tesla comes out with these fancy electric cars. They're the only ones until all these other companies start showing up. And they can offer the same distance with the same features and the same warranty, but at a lower price. Well, Tesla's got to lower their price, or no one's going to buy Tesla cars, and they're going to go out of business. Right? That's how the free market works. So it regulates itself, and it doesn't need government to do anything other than to regulate the big things. Like, hey, if I, the corn supply person, am lacing my corn with some fucking preservatives that are killing people's cattle, yeah, the government should come in and fucking take me out. May not kill me, but put me out of business. Have the EPA investigate. Like, they should be big picture shit, not minute in everybody's fucking assholes with their fat ass fingers.
I agree.
And I feel like that's what they're doing to the healthcare system. And if overall it's like, hey, all these people can't afford healthcare and they're getting denied by all these private facilities, we should make all these rules and give these people free healthcare, but really you're just making it more expensive for the private individuals with private health insurance companies. And it's like, it's fucking the whole thing. and sure, what do I really know? But if I can at least see and understand that much, there's got to be some real smart people in all of these different places, private insurance companies, hospital administrations, government, that can also realize, like, dude, we're kind of fucking up. Let's have a meeting and figure this shit out. There's got to be a better way. Let's always improve the foxhole. The only reason I can say that we're not is because it's working in their favor.
Oh, absolutely.
The corruption, the fucking price gouging, it's not about helping people.
No,
it's about the fucking power of the dollar. So we need somebody in a cape to come through and shut these fuckers down. And I don't know who that is. I don't know if it's we need to vote in the right president or the right party, or vote some people out of Congress or senators. Like, I don't really have the answers. And that's why I need another drink. So let's take a break and come back for the bonus. Unless you got something else.
I think I'm done on this topic.
Yeah, me too. Alright. Never mind. We said cancel the second drink, and this time we're going to cancel the bonus topic. It's been over an hour and a half that we were bitching about the healthcare system
and healthcare.
Yeah, and all that. So well, actually, I really was excited about our bonus topic.
Yeah,
that'll be really fun. But we will do it.
Save it for next time.
Yeah, on another topic. And we'll go ahead and close this one out. Mm-hmm. So thank you for watching. If you like the show, check out rebelshirts.com. It's rebel-shirts.com. Shirt, hat, found it there. And like, comment, subscribe, share with your friends. And we definitely appreciate y'all watching and subscribing. And we're going to keep pumping this out every Monday.
Yeah. Oh no, I can't cheers you.
It's all right. Next time.
Imaginary cheers.
Okay.
All right. Bye.
And we're out.